Okay, so we are online, and I would like to welcome you to a brand new format. It's the industry floor walk. And the industry floor walk is, of course, organized because of the COVID pandemic and a lot of travel restrictions, which a number of guests over here had. So the idea of us was to allow also these people from the distance to look at the different booths around us and to get an impression of the companies. And the first booth I'm visiting is the one of the company Nova Biomedical. And Nova Biomedical is a company which is well known for their analyzers, especially in the field of POCT. And I would like to introduce Anne Deutsch to you. She is with me, and she is presenting us today the machines of Nova. Can you introduce, or maybe can you say a little sentence about the company?
Yeah. So Nova Biomedical is a company, a US-based company, privately owned, which we are very proud of still. And so we are working globally, and we are focused on point-of-care diagnostics, especially critical care diagnostics. So we manufacture devices for the hospital mainly to diagnose at point-of-care, site of point-of-care. So I would like to start with our critical care analyzer, blood gas analyzer Prime Plus, which is one of our latest and flagship developments, which has all the blood gas parameters, including co-oximetry, but also 3 very new parameters.
Okay.
It's ionized magnesium, plasma volume, and BUN creatinine, which you can do.
Understand. So the question is always with blood gas analyzers, should you use this analyzer for additional tests too, for metabolic tests or whatever? And can you repeat the 3 new analytes you have on this machine?
This is ionized magnesium.
Magnesium,
yeah,
okay.
Which is the only analyzer capable of doing that. Then it's plasma volume and delta PV. So to monitor plasma volume and the delta of the plasma volume, and BUN creatinine, and it also calculates the EGFR then.
It calculates the EGFR, and creatinine is a very important parameter, especially in the field of intensive care units.
Exactly.
So can you tell me a little bit about the specimen you can use for this analyzer?
It's made for whole blood samples, venous or capillary samples, arterial samples.
Ah, that's good to see.
Yeah.
Okay, and you have also, I think you're using a standard specimen like it is over here, titrated blood gas monovates.
Yes.
Okay, I understand. I think the second field Nova Biomedical is known for are these handheld devices.
Yeah.
What do you think? Should we have a look at these handheld devices too?
You're welcome.
Okay, so yeah, wir bleiben mal links stehen. So if you look at these machines, perhaps you can introduce me. I think one of these machines, but I don't know them all. Can you give me a short introduction?
Yeah, so these are strip-based systems, like from glucose monitoring in the hospital. They are all designed for use in the hospital, and we have over here the device that's capable of measuring lactate, hemoglobin, and hematocrit by strip technique. And this is the connectivity device. You can connect it to any hospital laboratory information system, any LIS and KISS, or by our middleware, by NovaNet. And this is the handheld, the smaller device, which cannot communicate. And then we have a similar system here for creatinine, measuring EGFR, and the small device as well. And this is for glucose and ketone testing in the hospital, also with connectivity functions.
This is interesting. May I have a closer look at these?
Yes.
At this device. So this is for glucose monitoring.
Yeah.
And I think it's it's called the Stat Strip machine.
Yeah.
And there's the entrance for these.
This is the strip entrance.
The strip entrance. Can you show me one of these strips?
Yeah. These are the strips.
Yeah.
where you have the different wells for measuring the glucose. We're measuring the interferences, so substances that can interfere with the glucose testing and then give wrong results. So we measure that, and by an algorithm we deduct it then so that we can correct for the interferences, and it's just as easy as any glucose test strip system you know.
Understand. I think this is one of the points your analyzers are known for, that they can correct for different interferences. And I think that we have, due to the travel restrictions, we have a special situation. We have a guy from a hospital in the Netherlands who could not come over, and he did research on these interferences, and we are now trying something new. We would like to connect us to him via another Zoom conference. So 2 Zoom conferences, and I'm going over here. And perhaps.
Hi, Robert, we're back.
Perhaps you can introduce Robert shortly.
Yeah. So thanks, Robert, very much for your attendance. Robert Slingerland is the chair of the University of the Hospital in Isarlaken in Zwolle in the Netherlands, and this is also the Dutch reference lab, and he did research on interferences. There are many interferences in the glucose testing field, which can cause severe problems for patients, especially for critical ill patients, as you know. So this is the hematocrit. A high hematocrit or a low hematocrit can cause wrong glucose results. It's N-acetylcysteine, it's ascorbic acid, and this is especially the topic that Robert did research on for different parameters, because it's extremely important in critically ill patients.
Yeah. Robert, may I ask you, you just looked at these interferences. Perhaps, are you using these Nova machines in your hospital?
Yes, thank you for inviting me. Let's start with that for this interview from a distance. I'm sorry I can't be live at your place. But yes, we use about 4 of those blood glucose meters in our facility, and for that reason we investigated all those 4 instruments regarding the interference of vitamin C. And we did that because we wanted to know during COVID time, vitamin C was used as an experimental treatment for COVID patients, and we noticed some problems there.
Yeah, that's really interesting. And so what did you find? I think vitamin C is a very important interfering substance, and I must say I read a publication, yes, but for me it was absolutely new that vitamin C could cause such an interference. Can you describe me the interference?
Yes, thank you. High doses of vitamin C. So we used about 1,500 milligram 4 times per day in those patients. Those were critical ill patients. And if I say critical ill, those are at risk, higher risk for kidney injury and multiple organ dysfunction and mortality. And the vitamin C is applied to reduce the cytokine storm and limiting oxidative stress and enhancing the immune system function. At least that was the idea behind it. And we tested that according to different, using different instruments. We used the iStat, which uses oxidase as an enzyme, the Acetylcholine 2 dehydrogenase it uses, the HemoQ, also dehydrogenase, and the Stat Strip Express, which uses oxidase. All those 4 instruments, we applied whole blood from 3 healthy volunteers, and we spiked that blood with 50% glucose up to levels of 3, 7, and 12 millimole per liter. And subsequently, we spiked it with different quantities of vitamin C up to 2,000 micromole per liter. So that's about 20 times the normal reference range of vitamin C in the human body. The glucose was measured in triplicate, and we used the glucose hexokinase, which was traceable to new NIST standards. So we were pretty sure what the result of glucose should be. And what we noticed was that the Acetylcholine 2 at those high levels of glucose showed considerable elevated glucose levels. And the same was true for the HemaQ, but that started at a higher glucose or higher vitamin C added to the blood. Whereas the iStat and the Stat Strip Express had almost no interference.
I understand. Thank you very much for sharing these really interesting results with us. We are now at the end of our visit at your booth, and it was really interesting to see these machines, and especially the scientific information from you regarding these interferences were really interesting. So we are at the end of our visit at this booth. I would like to remind you that you've got the possibility to write us questions in the chat. So if you have questions you would like to address, you can write us, and then I will ask these questions to the guys at the booth. I would like to thank you very much. And now,
thanks, Robert.
Thank you. Thank you. So thank you very much.
Thank you for the opportunity.
Perfect. We are now changing to the next booth. It takes around about 5 minutes, and then we'll be back. You will see in between a slide, and we are now going over to the next booth. It's the company DIROI, and I'm really looking forward to show you the next booth from DIROI. Okay, see you.